Today I'm going to talk to you about three-dimensional imaging. This is a newer type of X-ray that is actually revolutionizing the practice of dentistry. The type of three-dimensional imaging is called a CBCT. It stands for Cone Beam Computed Tomography. It's a term used to describe computer-associated digital imaging in dentistry. This technique uses a cone beam shaped X-ray to acquire information and present it in 3 dimensions. The reason to use 3D imaging is because it greatly improves interpretation, diagnosis, and treatment planning in any aspects of the dental care. So why would you use dental 3D imaging? Well, it's great for implant placement, extraction or exposure of impacted teeth, definition of anatomic structures, endodontic assessment, airways and sinuses analysis, evaluation of the TMJ, orthodontic evaluation, and pathology evaluation. So today we're going to look at 3 different case studies where each clinician is going to recommend for the patient to get a 3-dimensional image.
And what brings you in here today?
Well, I'm having a lot of pain in my joint over here. When I go to eat, it's very sore. Even when I'm talking right now, it hurts. It's all in this area, and I want to know what the problem is.
Okay. Did this just randomly happen, or did something cause this?
Well, I was riding on a bike, and my daughter was behind me. So I looked over my shoulder to check on her, and I lost control of my bike. I fell over, and I hit the side of my face.
Oh no. Okay. Well, then we definitely need to get a 3D image to see what is going on in there. Okay? And the difference between the 2D image and 3D image is that the 3D will really show the full jaw and get a 360 view of it to see if there's any fractures or if there's any damage to it.
Okay, yeah, because I really feel like something's wrong.
Definitely. We'll get that done, and then we'll figure out a treatment plan for you to fix this and get any help that you need.
Thank you.
You're welcome. I've been having a lot of pain in the back of my mouth, behind my teeth, the gums back there. They hurt when I eat and when I brush. It's wicked sensitive. Everything's hurting back there.
Okay. Do you know if you had your wisdom teeth growing in yet?
I don't know. I don't think so, but I don't know.
Okay, so right now you're at the age where your wisdom teeth will be growing in.
Okay.
What we can do is we can use 3D imaging to see if there's anything going on back there.
Okay, well, why couldn't we just use the regular 2D imaging?
Well, you can use 2D imaging to see your last molars, which are your wisdom teeth there. But with 3D imaging, you can see overall what's going on. If there's any impaction that can cause pain in your mouth, and we don't want that to happen.
Yeah.
And there can be bone resorption that will mess up the entire teeth.
Okay.
And with the 3D imaging, we can tell if we need to extract your teeth or not.
Okay, that
right?
sounds good, yeah.
Okay,
Thank you.
let's get started.
Hi Marina, what brings you in today?
Well, yesterday was a really nice day, so I decided to go roller skating. I kind of rolled over a rock and I chipped one of my teeth, and it really hurts.
Oh wow, that's a big fall. Okay, well, first thing that we want to do is we're going to set you up with a 3D image X-ray. We want to take an X-ray that will show every area of the tooth that you think you hit to make sure that there's no destruction up there, because we want to make sure that we see every area, which the 3D image will help us do. We don't want anything traveling or anything bad happening above it. We want to make sure that the tooth hasn't actually, gone up into your jaw more. So that's the reason why we want to do the 3D imaging.
Okay, that makes sense. I was feeling a lot of pain around my cheeks too. So will that show anything that's going on around there as well?
Well, if the tooth is more into your upper jaw, it could have, or it just damaged the bone around it. It could have really made everything swollen, but we won't know until we do the 3D imaging to see if anything's going on or destroyed anything up there.
Okay. All right. Thank you.
So as you can see, the 3-dimensional imaging provides dental professionals with a more complete interpretive image than does traditional radiography. Three-dimensional imaging serves as a number of diagnostic purposes for dental practitioners. The advantages of three-dimensional imaging include a lower dose rate of radiation to the patient, a brief scanning time, anatomically accurate images, and ability to easily save and transport the image.